It's very scary.
Yeah.
Here now to talk more about the dangers of teens using those hand sanitizers as a way to get drunk is Dr. John Pettini.
He's a St. Francis Hospital doctor of emergency medicine. Good morning, Dr. Pettini.
Good morning.
This is really frightening. It's kind of like, what will they think of next?
Yeah, I think historically the youth have kind of come up with creative ways to find, a way to mimic getting something for substance and alteration, and this seems to be the latest trend.
Now, you look at this, and obviously we know, the problem and what they're using this for now, but what other effects can this have on the body? I mean, drinking a substance like this.
Well, the main thing with the hand sanitizers is that they have to contain a high amount of alcohol to actually have antimicrobial activity. So it's usually a minimum of 60%. And if you can remove the gel portion, the alcohol you get left is about 110 or 120 proof alcohol, which is a pretty strong shot of vodka. Mm-hmm. So the danger of it really, it's not a toxic alcohol in the sense that we think of methanol or the other alcohols or isopropyl, but this is the same alcohol that's in an alcoholic beverage. The danger is that it's in the hands of kids and the alteration and the trouble that comes with, intoxication.
Now, we just heard that this is becoming a problem in California, but you haven't had that happen here at St. Francis Hospital, at least not yet, but you've certainly been made aware of the situation.
Yeah, we're aware. We actually have an in-house toxicology service at St. Francis, and we've had no cases that we know of. And it's difficult to know because it's the same test we would use for conventional alcohol. So unless it was brought to our attention. But we have no awareness of any cases even in the region.
Now, other than maybe the antibacterial soap being used a lot more frequently, are there any warning signs that parents should look out for?
Yeah,
I would imagine this is kind of hard to detect.
It is, but I think it's an awareness. I think back at the times when kids were really drinking a lot of cough medicine with dextromethorphan, Robitussin, and you'd wonder, why does your child have all this cough medicine all of a sudden if they're not sick? There's been other things with like Coracetin. So I think just parents need awareness of what their kids are up to. If all of a sudden they have an interest in hand sanitizer, you'd have to ask, why is this? I think something to point out too is that a lot of the information we've been hearing lately is from California, and they had a rash of about 16 kids in the past couple of months. But truly, from the poison control data, they've had about 2,200 ingestions of hand sanitizer alcohol in the pediatric population, but the overwhelming majority of those were actually accidental ingestions by infants, toddlers. So I think the big take-home message here for parents is you got to treat it like any other medication. You don't want hand sanitizer that if you have a toddler or an infant, they're curious, they're going to ingest it, and then I think that's kind of more the danger at this point.
And it's funny, well, not funny in speaking, but I have hand sanitizer all over the house, and I wouldn't even think. I think of if somebody comes over and they're going to touch my infant, they're going to use, the hand sanitizer to use it. But now that she's trying to get into everything, you don't even think of the fact that, well, if she hits that and ingests it, that it from an accidental standpoint, it can be frightening.
It is, and again, they've been strongly marketed, especially to parents with children, as a easy, convenient way to keep
Kill
kids
germs,
clean,
right.
kill germs. The reality is that good hand washing with soap and water actually is the best, and this is what the CDC recommends. If you don't have soap and water and you can physically clean the visible soil off your hands, then hand sanitizers are fine. But they really work no better, so there's no magic to it. So
it just seems to be more of a quicker fix.
it's a quick fix, especially if you're traveling.
But how do you suggest the parents talk to their kids about this? I mean, especially if they haven't even heard really about this yet. Is it something that you should bring up to them and talk about the dangers?
I mean, prevention and open discussion in families is the biggest intervention you can do. If the parents are actively involved with the kids and you bring this up as a topic, that's what we find the best. Adolescents and teens are always going to be curious. Information now disseminates very quickly. What kids are doing in California is seen on the internet and YouTube today in real time. So, kids here will know about this, and I think it just make it a topic of conversation.
Yeah, it kind of makes you wonder if eventually they'll have to be locked up or kept behind a cabinet like they had to do with cough syrup.
Yeah, or if even they'll need an ID to purchase it in a store.
And it could shift. I mean, when we saw a lot of the mouthwashes had a high percentage of alcohol, almost all the manufacturers have brought down the percentage of alcohol to make it less appealing. I don't know how they're going to do with hand sanitizers, at least alcohol-based, but now there's a whole new generation that are coming out that are non-alcohol-based. So the parents may want to either A, choose non-alcohol-based hand sanitizers, or the next recommendation is the foam-based are very difficult to extract the alcohol from.
Interesting. Dr. Pettini, thank you so much for being with us.
Thank you.
All right.